Hello, my name is Aella Morad, a University of Victoria nursing student. Thank you for watching this video and for your support in helping myself demonstrate my leadership in nursing. The reason why I picked this subject of the application of alternative therapy for clients with Alzheimer disease as an educational in-service is because of my grandmother whom has Alzheimer's. I used to show her yoga exercises and play music for her. But now with the progression of her disease, my family has needed to admit her into a long-term care facility. My grandmother is doing well, but the regulations of the long-term care facility are not favorable towards music and yoga being conducted there. The purpose of this video is to give a more personal perspective of my PowerPoint presentation. I emailed my presentation to a variety of healthcare professionals, but with reflection, I feel it is necessary to add a testimonial to convey this idea of the presentation further. For clients with Alzheimer disease, like my grandmother, alternative therapy has the potential to be a positive contributor in so many ways. For clients in the early diagnosis phase, it can improve the client's lifestyle and adopt healthier attitudes and approach to their diagnosis. It can also improve the quality of life in the following ways. It can create calmness in oneself. It can bring the clients closer to themselves too. It helps them connect with themselves. For healthcare professionals, it prevents caregiver stress, which is a very huge topic on its own, and promotes the client's autonomy because they have to want to participate in the therapy in order for it to work. Alternative therapy for myself is a positive form of healing that gives a certain level of control back to the client and restores a balance back into their lives. A more specific definition is that it's defined as any practice that puts forward the healing effects of medicine but is not based on science. So anything like smiling, laughing, these are all forms of alternative therapy. The two therapies that I focused on is yoga and music. And being a yoga teacher, I'm clearly biased that yoga is an effective therapy for anyone and at any time. And for music, I worked as a facilitator for the Veterans Hospital in Montreal, and I conducted memory classes. The application of music in the memory classes was so positive that the facility wanted to promote it into a day program to give more opportunities for the veterans to participate in this exercise. And it was very positive. They actually sang with the music, and it was very, very touching and moving. I want to focus on the barriers to alternative therapies. There are limitations to credible research. It is difficult to recommend a practice without sufficient research to prove its safety. For example, pharmaceutical trials will always have double-blind studies to prove the efficacy of the drug with quantitative analysis. Most of the authors for the alternative therapy articles are nurses and caregivers. We need collaborative support, and research shows that doctors' opinion has a lot of weight in society to manifest change. Historically, using restraints and medicating clients to treat aggressiveness has been the main approach, but now we are becoming more aware of the side effects of the medication and the client's right to dignity. It is difficult for healthcare professionals to preserve a client's dignity if restraints are being used. Alternative therapy was used before all these traditional therapies were being used, and we need to go back to the more holistic approach of caring for clients with Alzheimer disease. We need to standardize the care to provide a higher quality of life for Alzheimer clients. The standardization of care needs collaboration, communication, education of alternative therapy for everyone involved, the stakeholders. For example, at the Hope and Cope, a resource branch for clients with cancer from the Jewish General Hospital in Montreal, where I worked, I gave yoga lessons for breast cancer clients, and other holistic centers across North America adopted the same format as Hope and Cope. And this is an example of a successful approach of alternative therapy that is accepted and promoted in other facilities. To conclude this video, it is very important that there's an acceptance of care, not only from healthcare professionals, but for the clients as well. They have to want the therapy. And the resistance of healthcare professionals that are not comfortable with trying anything new and different needs to be addressed early on with education and encouragement. We need everyone to we need to support everyone and for everyone to be on board. Thank you.